Call to order the City of Franklin Board of Health meeting, September 11, 2023 to order. Roll call, we're missing Dr. Golden and Alderman Mark Barber, and
Amy
is excused. Okay, first thing would be approval of the minutes. It says May 8th, but it would actually be June
12th.
12th. Is that it? Everybody have enough time to look at the minutes? Oh, hi, Dr. Golden. Dr. Golden is now here. Does anybody need more time? So would anybody like to approve the minutes from June 12th?
I move that we approve the minutes.
Okay, do we hear a second?
Second.
Okay. Any discussion? Hearing none, all in favor of approval of the minutes from June 12th, say aye.
Aye.
Okay. I take it we're no citizen comment period from your mother?
No.
Okay. Okay, so then we'll move into unfinished business.
None.
Okay, then we'll move right away into new business and the administrative updates. And I think we're going to start with our mission and our vision.
Yes, I am excited to talk about this today. So the health department has been focusing on a lot of internal growth, and we've brought our mission and vision to health department review. So over the past few staff meetings, we have come together to collectively brainstorm a new vision and mission that's updated and that the staff feels that really resonates with them. And the finalized version of what the staff have agreed upon is in front of you in your packets today. So the mission would be to protect and promote health and well-being within the Franklin community through disease prevention and health education. And the vision is a thriving community in which everyone has the opportunity to live their healthiest life. So the staff and myself wanted to bring it to you guys as our Board of Health to get any feedback that you had and get your eyes on it before we officially brought it forward to be real.
What would you say is the biggest change from the old mission and vision?
I would say that the staff that currently works here had input on it. That overall. But really, I think that the vision is a little bit more all-encompassing in its optimism. So really looking at a thriving community that we want here. So everyone across the community as a whole is living their own healthy life.
What was the previous mission and vision?
I can read it to you. One moment, please, and I will pull it up. Okay. We have had many renditions of this, so it's not on top of mind. Okay, mission is to protect and promote health and prevent disease and injury in the Franklin community. So similar, but we added some health education and the word well-being. And then create a healthy Franklin where all residents are able to meet their highest potential. So highest potential swapped with healthiest life, and then just some verbiage with everyone. That is where we evolved to.
Thank you.
Yes.
Any other discussion? So are you looking for an approval for this new one?
Yeah.
Okay, then I need approval for the new mission and vision statement for the health department and Board of Health. Okay, and a second?
I'll second it.
Okay, is there any other discussion then? Hearing none, I think we're ready for a vote. All in favor of the new mission and vision statement, say aye.
Aye.
Okay, it was unanimous. Okay, then we'll go into the 2024 Health Department budget.
Yes. So budget season is among us for the city of Franklin, and the health department has prepared the 2024 budget proposal. So this will be proposed to the mayor to bring forward to the council. I did not have any change in our operational budget from this current year to next. A lot of the benefit of the grant funding that we write for is to help enhance the work that we do on that kind of level. So supplies, travel, training. And with the times that we're in right now and really just the money saving trying to happen across the board, the health department analyzed our budget and decided that for 2024 we would be able to stay stagnant for this year and then hopefully increase by tiny percentages next year. But we did go with the fire, and we talked about this a little bit maybe. I can't recall where our meeting landed last time, but with fire and police and the health department, we all jointly met to discuss the benefit of having a shared social worker. So this would be a public safety social worker. We were requesting 0.33 from each of our 3 departments to be able to respond to resident needs. So think human health hazard, frequent falls, social service referrals. How that structure works now is the Franklin Fire Department or Police Department or a resident typically make a referral to us. Oftentimes when it's from a municipal partner, they say, okay, well, we've responded to this residence 3 times. They keep falling, not able to get up. We go there. Oftentimes they're soiled, have been on the floor for a long time and really need some kind of assistance or intervention. And then the health department takes that on as a social service referral case, as you guys know them, how I report them out, and follow up with that individual, help connect them to services, really identify the need. And we have found that this has just been greatly increasing every single year. So many cases are coming in where Franklin Fire and PD are responding multiple times and residents are just really in need. And we know that Franklin is an aging population. Like, we're aging in place more frequently now than ever before. So we're only going to have more individuals paired with economic growth and development in our community. So we can't stay the same. We're already overwhelmed in the health department. We have currently a nurse who responds to these alongside myself. So to ensure that everyone's operating at the top of their license, we really just want to assess how to best do that to save Franklin Fire Department resources, police, and health. So we brought this forward to a conversation with the mayor and administrator about 2 months ago, and they welcomed us to put together the proposal, and we submitted that. So in your packet, you will find, you will not find the official proposal that we crafted, but I was going to include it. But essentially it says what I said just now to you, and I'm happy to share that with you guys if you're interested. Today we did have, on Friday it got put on our schedules that department heads were having finance meetings today with the administrator, finance director, and mayor to get an update on the budget process. We'll be taking forward our budget conversation to the finance committee at the end of September or October, but it was shared that most likely that will not be funded for this budget period.
The social worker won't.
Yeah, so this is my first really robust experience in proposing a position like this, so I don't actually know all of the logistics to follow, but I would imagine that it's going to come with a presentation of my own, as well as every department head to the committees that may be analyzing the budget to move forward. But we still really find it to be of great value. I expressed in our meeting today that we could look to potentially modify the position structure, maybe take it down from a full-time to a part-time with no benefits, just depending on what budget could allow. Grant funds for positions within the health department are pretty prescriptive, so it's not likely that we'll be able to write a grant for a new staff member in the health department, but I'm hopeful that maybe fire, police, or myself, we can think of something creative if there's not tax levy to support it.
So, I'm curious. I've actually been wanting to speak to this, at a council meeting. I don't know where you advocate for something like this, but I don't know that much about budgeting. But somewhere I read with the shared revenue that Franklin's going to get another $800,000. So, do we know where that's being spent? Like, how can I better understand that process? I mean, I know a lot of people that would advocate for a social worker position for Franklin. but I'm not sure what the process is for making that decision.
We do have the finance committee within the city of Franklin, so I'm not sure if that's the most appropriate place, but I definitely welcome a phone call to the clerk's office to help decide that, or I can help you. We can look to see where that might be. But I do know that the mayor does bring his proposed budget forward to council, and then individuals are welcome to speak at it at that time.
Oh, okay. So one could speak directly to the administrator and the mayor and encourage certain decisions around finance?
Henry, do you know the answer to that? I don't know, but I'm happy to check on that for you.
I would talk to who your representative, your council person is,
Okay,
and I would go, that would be my first direction.
I'll try that. Never had much luck with that, but I'll try that. I should
Yeah.
say that.
With the sharing of the social worker on the police and fire, is he or she going to be able to take that on as a workload?
Yeah, so right now, all of the cases are funneled to the health department currently that are fit within this social service realm. So frequent falls, like I talked about, human health hazard. And right now it's on the top of the workload that our nursing staff are already doing, and myself. So we're looking to structure it. Again, this is now all hypothetical because we don't know how it will play out, but really using that first year as a discovery period, but also realizing that they most likely, based on the trajectory and data we've already collected, will not have a shortage of cases. But health department did offer that individual could be housed within health, and then we would all just then split the financial burden of such a position. Right now, out of the conversations that we preliminarily had, well, we had many conversations, but the ones we had amongst ourselves with administration and some really valuable insight that they provided us is really thinking about the hour structure and how we would want that to look. And right now, we believe that it would be best served during, quote, kind of regular business hours, because limited times is a crisis call to the health department for intervention with such a case. So that would provide the opportunity for the referral to still come to the caseworker and then get it the next day and be able to respond. But we're going to use that first year, if ever it's funded, for that true discovery, data collection, and future direction.
What happens when the social worker is overwhelmed?
Well, I think that's when we advocate for a 2.0 FTE. But yes, I mean, the health department, fire department, and police department are always here to support that. We also get referrals from like the library or residents. Referrals will not stop just because we don't have a position for it. So we're trying to address it now when it is still a burden, but before it's crisis level, and hopefully start making small steps in the direction to best serve the citizens.
And that, to me, sounds like the most cost-effective position.
Yeah, because also when fire responds, they have to bring a full
Right.
response crew.
Yeah, good point.
Okay, now this would be all social services, so not just somebody falling, but hoarding.
Yep.
What about like drug problems? So it would involve the school too.
Yeah, well, it can be youth, but also adults, like
Oh, sure.
opioid misuse.
But if it involves a school, would they become now a partner in this?
The health department is already a close partner with the district, but I'm sure that we can explore avenues to even stronger support system. Also, licensed social workers have different avenues to be able to access services than
From the
clinical
county.
nurses. Yeah.
Right.
I'm also curious, were people thinking that this might be part of the position, or do you think it would be too much? And we talked about trying to get a social work intern at the library. And it would be helpful if we had a social worker working for the city, then they could serve as their supervisor. If not, the library would have to fundraise to pay a supervisor if we were to get an intern. So if we had a social worker, they could extend the hours, you know, the social service hours we have access to by supervising an intern. But if that would spread her too thin or him too thin, did that come up in any discussion or proposal? I think we...
It didn't, but it is always an option. I mean, having a funded position will open avenues that we can explore into the future.
Okay.
But right now, it sounds a halt because of budget constraints and restrictions, and that's what I'm here to share. So that's where we moved it forward. So we put a 0 change request on the operating budget, and then that 0.33 from health increase in FTE. And so I'm looking for support today to officially submit this to the mayor and administrator.
So I don't think this needs well, we'll just ask for full board. Anybody opposed to this idea?
Not here.
Okay, then I think the board gives its approval for that.
Great. All right.
Okay, then we're going to move into the summer 2023 report.
Yes, since we have, oh, I'm sorry, actually, we do need I would like an approval. So Henry and I drafted this letter, which you'll
that's
find
okay. I was
next.
going to say, okay.
And it outlined, so the Board of Health recommending the proposed 2024 Franklin Health Department budget to support our needs and functions. It outlines the 10 public health staff, administrative Rule 140, which is what the health department follows based on statute and rule, and then the public health core competencies. So the things that we are required to do to be a level 2 health department. Surveillance and investigation, communicable disease control, disease prevention, our emergency preparedness and response responsibilities, health promotion, the human health hazard that we touched on, policy and planning, leadership and organizational competencies, and our nursing services programs. And I'm looking today to take this drafted letter from Henry and myself and then submit this as well with the budget proposal. And that I think would be more of an official approval.
So this does not include the social service.
At the bottom it does say, it says, important to note is a collaborative request for a shared 1.0 FTE social worker among fire, police, and health to be added to in 2024. So I'll leave that in there, and then we do know that that will not be funded as of right now, but I think important to note, and then we can look to future years.
So I need somebody to suggest this recommendation.
So moved.
Okay,
I'll second.
any discussion? Then all in favor, say aye.
Aye.
Opposed? Okay.
Thank you. Since we've modified the structure of our Board of Health meetings to now meet every quarter, we have done a 2023 recap for the Franklin Health Department activities, events, and numbers. I'll reference this a few times throughout, but just giving an update on the direct services that we provided within this report. On the back, you'll see that we had 62 inspections since June of 2023. So these are those routine and follow-up re-inspections, on-site visits of our environmental health staff, so our sanitarians going out to retail establishments. 152 communicable disease follow-ups by our public health staff, and then 147 direct services. So some of those are blood pressure checks, those shorts collections we do, radon test kits, car seat installations, and then animal bite case follow-up for our rabies control program. So that's over June, July, and August. I can touch on the rest of this report as we kind of go through the rest of the agenda here tonight, but it highlights some of the other activities and events that took place.
Any questions or discussion? Hearing none, we will move into clinical service updates and the immunization clinic dates.
Yes, so we have our adult flu clinic and all-age flu clinic scheduled for the 2023 flu season. They are published on the City of Franklin website, but we do have one on Wednesday, October 4th for 65 plus. So that is in partnership with the Adult and Wellness Health Fair that we host every year over at the library. So that'll be 9 to 2. We have one on Tuesday, October 10th and Tuesday, October 17th from 1 to 4:15.
What
And-
immunizations are going to be,
Yeah, which ones are you doing?
We are doing flu. These are
Just
flu.
flu.
But if other individuals have a vaccine that they need normal clinic hours, we can make accommodations. We also are looking as the turning tide of the COVID-19 vaccine and privatization and the VFC, VFA program, possibly bringing that on. We'll most likely do COVID boosters again, but I'll provide you guys with an update at that time. This is all actively rolling out within like the next few days. If we do, Dr. Golden, you'll get some updated policies and procedures about that for approval. But I would say it's looking very likely that we would be having COVID-19 boosters through our BFC program. And then we have our all-age flu clinics on Wednesday, October 18th and Friday, October 22nd or 27th. Our clinics are always very well attended, which is exciting, especially our adult health and wellness day flu clinic. So we'll expect hundreds of people, hundreds of seniors to come on that day. We also, I'll hop ahead to COVID tests.
yes.
Okay, great. If you recall, were selected to do the pilot of the COVID test kits. We've had some interest. I wouldn't say it's a huge level of interest, but we're continuing to do the same plan for our protocol of handing those out through at least the end of 2023, where we allow people each person from the household can come for a pack of a test kit every month. That has not been a problem. We were wondering if we were going to have such a high demand that we wouldn't be able to keep up with that, but we have been fine with that so far. I'll talk about it a little bit later on too, but we did the summer concert series, and at one of those concert series here in Lion Legends, we offered those as well. So it's been a fun opportunity to be able to get out and about and share those with people.
The next would be the communicable disease report.
On the back of your summary here, you'll see a breakdown of the communicable diseases. You will find that we are still having COVID-19. A slight uptick in the recent weeks, which I'm sure you've heard about, probably among your family and friends as well. And we're still doing calls. So if someone has COVID-19, we do follow up still based on the category of disease it is. And then pretty on point with our other illnesses that we're seeing come in. We have not had anything unique in the last few months. So still greatly leaning to COVID-19 being the highest.
This is for, I'm sorry, June, this is for the last 3 months.
It is.
Okay, any discussion or questions on that? Hearing none, we will move into the health department programmatic updates.
Some of the past programs that we had over the summer are the summer concert series. So Sundays in the summer, the concert series group hosted music at the band shell, and the health department and Volition had tables there jointly to share information, so prevention-related information for the residents. It was good attendance. So it tends to be an older adult crowd, but there's always some youth trickled in there, so that's fun to see a variety of individuals. We hosted the bike rodeo in early June and had over 100 participants. Well received as always, and we were able to do the bike helmet fitting and distribution, working with the police department and a huge number of volunteers. So that event itself is hugely dependent on the individuals who volunteer their time and then the sponsors, and it's really appreciated. So great event for that. We wrapped up our nutritional series.
How many attended the bike rodeo?
About 105.
Okay.
We had our nutrition series, so that was those COVID-19 reallocated funds that we applied for through the county, and it was able to be used for older adults and addressing gaps and needs in our community. So based on nutrition information we have gathered, we know that that's an area that we would like to increase. So increasing self-efficacy of creating a healthy meal and the know-how, but also the ingredients. And we first went to senior dining and then had a few pop-up sessions at City Hall. That was great as well. So we had some evaluations on that, gave out some crock pots with that funding, carpeted the health wing so it's a safer environment. And we've had a lot of good feedback on it. So these chairs are a little less risky than they once were. And we're really happy with how that turned out. So staff were really active in drawing a large crowd for that. We were at National Night Out, so the police department holds that every year at the library parking lot, and Volition and the health department were there to share safety-related information with the community. The outdoor movie night, I almost forgot. Volition Franklin and the health department put on the outdoor movie night every year, so a family-friendly event that's substance-free. So encouraging youth to get out on a weekend, weeknight, traditionally, but we changed it this year, and it was great. So Megan was the lead on that, and we showed Minions, and the kids had a great time. And now to come is the Adult Health and Wellness Fair, which I mentioned, Wednesday, October 4th from 9 to 2. Individuals are required to make a flu shot appointment to come there, but they can come for the resource fair without an appointment. But we heavily encourage and push that people need an appointment to be seen for a flu shot. Walk-ups we cannot guarantee would be accommodated just based on supply. But we have a lot of vendors already in the queue, and it should be a really robust event again this year. Trunk or treat. So we kind of, if you remember, inherited this a while back because there was nowhere really to host it anymore. And it's a pretty big event now. It's pretty large. So we didn't know it was going to turn into that, and now it's really thought like 1,000+ people attend, and we host it at the library. So always trying to figure out how to make it even better. And we've thrown around the idea of like a at-night outdoor movie night with just a kid-friendly fall film on, or music, or a dream would be to do like a pumpkin carving display, but we have many grandiose ideas based on the planning committee, and we'll see where it goes. But Volition Franklin has a lot of things in the works for that.
What is trunk or treat?
It is when local businesses are invited to come and decorate their trunk in a family-friendly way and of their car. And then it is on the organization to provide wrapped store-bought candy or healthy alternatives to individuals who come by. So I know this is just the thorn in people's side, but we do require registration because the trunks need to know how many people to anticipate, and then for safety reasons with the PD and coordination. But we have people register, and then they can come at their slotted time and then walk through like their trick-or-treating, but they're just going in a safe environment in a parking lot that's closed
And they
off.
come in costumes or not really?
They do. They come in costumes, and the trunks are in costumes, and it's really well received.
Yeah. There was well over 1,000 people there last year. It was a very big event.
And it's no cost to citizens, and the organizations have no cost as of right now, and we're not anticipating, and we're going to always analyze it for sustainability, but right now they do not have to pay to be there, but they bring their candy, which is really nice because that would be so much money.
So how many organizations come?
30 plus?
Last year, I think we had about 45 trunks around there. We're hoping to get 50 this year, just because we have such a big space in the parking lot, but we have like a fire truck came last year and a lot of room, so hopefully 50 this year.
Were they all prepared for 1,000?
Mm-hmm. So that's why we make people register. So we
Okay.
say anticipate 1,000 people, and then they can bring accordingly based on that. The first year, no, we were not ready. We did not. We did have people register, but we said, "Oh, we'll bring 500 pieces of candy," not thinking that we would be giving handfuls. But everyone was really understanding. And I think still, obviously, a lot of people had fun because people are still doing walk-ups to that. So always welcome to suggestions for that, but it will be at the library this year on October 26th from 5 to 8. So everyone listening at home, it's 5 to 8 on October 26th.
You can register at the library.
Yeah. And then we're recruiting trunks as well, so then the Franklin Health Department will coordinate to individuals who wish to have a trunk. All right, and I brought a whole host of flyers for you guys for those upcoming programs that I mentioned. We also have Stay Healthy and Active as You Age. It is a speaker that we're having over at the library on September 20th, Dr. Steve Anderson from Midwest Orthopedic Specialty Hospital. So we can pass that. We're hosting a Mind Over Matter. That is a healthy bladder course that's coming up in October. I'll pass around one for the Health and Wellness Fair, and then Trunk or Treat as well. And then we have one more thing, which is a balance screening on September 14th and 19th. So all of these will be on the City of Franklin website, and we're planning to make a current events and upcoming events bulletin board in here, but until then, you guys can
Sorry.
have all of these flyers.
Oh, one more. All right.
One more. I guess.
Pat, I'm giving you a bun. Wow.
And we always welcome volunteers. I know that you guys give a lot of your time already as Board of Health members, staying up to date on the latest happenings. Oh yeah, when you do yours, if you want to pass that out. But if any of this piques your interest or you want to volunteer or know someone who might, feel free to send them our way. Anyone have any thoughts or questions about those events as we're kind of circulating the flyers?
These are great. Sending them to my mom.
Yeah, good. Send them to anyone you know.
Okay, well, we're going to next go into 2023 tobacco compliance checks. Now, was that put on hold for a while, or?
Yes, for just in, was it in 2020 and 2021?
Yeah, I think
Yeah, and then we did them last year.
How often are you doing?
We do it annually. So the
Just once a
alcohol,
year?
yes,
Okay.
the alcohol compliance checks we're doing twice a year, and then the tobacco compliance checks we were doing once a year. But I'm going to turn this over to Megan, so let me just introduce her quick. This is Megan Conway, our Drug Free Community Coalition Coordinator. So Megan works in the health department and has been with us for a year, almost to the date. So we're really excited to have her. She's super active in the Volition Franklin Coalition. So leading everyone who volunteers with that group, and also very heavily active in the Volition Franklin Youth. So we have both a middle school club and a high school club that keeps Megan on her toes. And a part of that is the tobacco compliance checks. So she'll go into a little bit of detail about what the process is. I know a lot of you know this, but I thought it would be fun to just share a little bit more about it and give you an update. And then talk about the compliance checks we've done this year. And then we'll scoot right into a Volition Franklin presentation. So Megan has been really busy over the past quarter doing a lot of focused work on opioid prevention and an opioid toolkit for us here in Franklin. And I will let her give you all the fun details on that. But go ahead, Megan.
Yeah, so I'll start with the tobacco compliance checks. So back in, I believe this was June, the health department and Volition partnered to do tobacco compliance checks. So we do that under a grant, Wisconsin WINS program. So it's state funded. They give us all the guidelines to follow. We recruit 2 Volition Franklin youth. And then myself, Ellen from the health department, I didn't go this year, Ellen from the health department kind of took the lead. And we take those youth to 12 stores in Franklin. We randomly generate them from the list of stores throughout the city, and then go and send a youth in. We have, Jamie also went, she was a nurse, so we have an adult go into the store first, make sure that the youth student that's going in is safe, feels safe, and then that youth will go in and attempt to purchase a tobacco product along with, candy or chips or something. We were pretty happy with the results this year. We had 11 out of the 12 stores pass. And so with that, we work with the police department for individuals and stores that don't pass. But the stores that did pass, we went back, gave each store a certificate, thanked them for keeping our youth safe, and it was just kind of, good to put the names to the face. We told the store owners, you have great store clerks that are keeping your youth safe and are not selling. So very happy with the compliance rate after coming back from a hiatus for a couple of years over COVID. All good things about that. So, yep, we do those annually. We're hoping to try and get a jump start, get everything together to do those within the next year as well.
Do you know how many vendors or places do sell cigarettes or tobacco products in Franklin?
Yeah, we do have a list, and I don't know that I can say how many. I think it might be over 30-ish, but I'm not entirely sure that I can say that confidently.
We can get that too.
Yeah, the
Okay.
state compiles all of that, and then we pull from their list. Actually, I don't know that we might have less than 30. I don't think we have that many stores. But yeah, we can get a list together.
And what is the penalty for selling?
So it would be a fine, and then typically I believe that the seller might have to appear in court as well before the municipal judge.
Is there a follow-up check?
We don't do a follow-up check, but
They could be within the randomly generated list.
Okay.
So that does not exclude them just because
Further.
we've checked
Okay.
them.
And do penalties increase with the increased violation?
Here's a fee schedule that we follow from the court.
Okay.
any other questions? All right, so I will move into the opioid misuse and overdose prevention toolkit. I would love to take full credit of this, but we had a really amazing intern at the health department from Marquette that helped put this together with us. So really, we just tried to compile state, county, and city data. We worked with the police department and the fire department to compile data on overdoses, that kind of stuff. So our first page is just kind of a overview, because we talk about prescription versus illicit opioids. So just kind of give someone that maybe doesn't have a real idea of what fentanyl is, then we can kind of describe that so it's easier as you read through the document to kind of get a better feel of what we're describing as we go through. Overdose overview, we just talked about the different types of Narcan. There's nasal spray, there's injectors, there's auto injectors. Typically, as a layperson in the community, if you go to a local health department and they're giving out Narcan, you typically see the nasal spray, but like EMS uses the injections, so we like to put all of those in so that if anybody has questions or may see different types, that they kind of know what they're looking at. We talk about what overdose may look like as well, and then our next page is how to administer. So trainings are available throughout the state and county for people to become trained on how to administer Narcan, but this is just kind of a small rundown with that nasal spray, how you place someone in the correct position if they're experiencing an overdose, and how you administer that plunger. The next page, please stop me if I'm going too fast and you have questions as well. The next page, overdose prevention. We kind of wanted to split this up. As a regular community member, what can you do to, prevent overdoses from happening in the community? So only use medications as prescribed to you, keep medications out of reach, that kind of stuff. For medical professionals, learn how opioid use disorder is diagnosed, watch for signs of patients, that kind of stuff. And then we also had a small piece for legislators. How can you support that legislation that promotes harm reduction resources, that kind of stuff as well. The next page, we wanted to jump into statewide data. So as is the state of Wisconsin, what kind of things are we seeing on opioid misuse in the state as a whole? So we kind of tried to break it down by numbers. We do have a public health advisory that's been issued because we've seen such an increase in fentanyl. So a lot of drugs are laced with that. People don't know that it's mixed in things that they're taking, and it is very deadly. So kind of trying to take it from the big picture and then move down from our state to the county. We talked a lot about Milwaukee County data. We've seen increases in overdose deaths looking at data from 2016 to 2020. Kind of paints a bigger picture for people that maybe aren't involved in looking at overdoses. If you're not talking about it all the time, it's kind of hard to be aware of what's going on. So we wanted to see what's going down in the county. And with the county, we have Milwaukee City included in that, so we do see bigger numbers. But we can see year by year when how many people are given naloxone each year experiencing overdoses. We can see, what types of substances people are overdosing on. So we see, high increases of fentanyl from 2019 to 2022 at the county. But we also see that, locally as well when we move into our City of Franklin data. So again, we did a lot of work with the police department and the fire department. They were sharing a lot of data with us so we could kind of show it in beautiful charts, make it a little bit easier to kind of understand at the community level what we're really seeing. From the fire department, we've seen that suspected overdoses have increased since 2019. There were 75 incidents reported in 2019, and in 2022 there were, 75 incidents reported in 2022 compared to 68 in 2019. So we are kind of seeing a little bit of an increase. We kind of broke it down so you can see, the green bar, it kind of looks like maybe administrations are going down, but we also added the police department Narcan administrations to kind of really show that, it's not necessarily that they're going down, but it could be that the police department is arriving on scene first, and they are also administering Narcan to people experiencing overdoses as well. And then we just kind of broke it down by age, race, ethnicity, age. We can see in Franklin that, some overdoses are happening everywhere. They're happening in apartments, but they're also happening mainly in those single-family private homes. So that was something that I think we're a little surprised to see, just because when you don't know, you don't know, right? So you can break it down and see kind of where those are happening. We also broke it up between non-fatal and fatal overdoses within the city. So where are non-fatal overdoses happening locally versus where are they happening when people are experiencing fatal overdoses. And they do kind of coincide. We are seeing residential homes in both areas of fatal and non-fatal overdoses. Again, we're seeing fentanyl locally in the city as well, not just the county. So we know that's here. It has made its way to us. And then we wanted to provide people with resources. So if you're experiencing substance misuse, if you have family members and you want to be there as a support for them, but you also need support for yourself, what can we do? So how you can access Narcan, if you need support or if you have a loved one that needs support, what if you want to just get more education? We put that out for federal and state resources. We also included county resources for anyone in the county. For behavioral clinics, what do you do if you just need a text line? We put that in there as well. What if you're just interested and you'd like a Narcan training and you want to be trained? So try to include kind of everything that we could think of. And then locally in the city, we talked about what if you have, expired, unused medications, what do you do with them? Don't just throw them away. So we included our medication drop box. If you can't take it to the drop box, what do you do? Well, we have drug deactivation kits that the health department gives out for free. Put your medication in there. It's got activated charcoal. You just pour it in with water, seal it up, and you can throw that away. And then we also wanted to include a couple of local support services as well that are in Franklin. So we have two options, the Aurora Behavioral Health Center, and then the Southbrook Church has a support group that meets as well. We did include a page about Volition, as we are a community substance misuse prevention group. So it kind of breaks down the things that we're seeing. We're supporting a drug-free community, gives a little breakdown on the efforts that Volition Franklin has been in over the years. We did a little breakdown of what we're seeing in youth, and that would be across the county, or across the state, excuse me. So youth prescription pain medication misuse across the state. And then again, our local recommendations, we just wanted to see what are options that we as a community have. What are things we're seeing other communities and other counties doing, and how can we adopt those things into our city. And acknowledgements, like I said, we had a really great intern, Claire, that did a lot of the legwork for us. We gave her a lot of data, and she really did a wonderful job putting everything together. And so I'd like to acknowledge her and all of our partners that helped us gather all the data as well. I know I kind of ran through that fast, but
No,
if you
that's
have
fine.
any
No, that's
questions,
fine.
please let me know.
Yeah, I have one question. Of the non-fatal overdoses, how many of the non-fatal are attributed to Narcan? Do you have an idea?
We do have Narcan administrations. I mean, anytime that someone is experiencing an overdose and they're non-responsive and they have Narcan used on them, I would say it is
Because of
effective.
Narcan.
Yeah. When someone's experiencing an overdose, they are typically non-responsive, not breathing, and that Narcan will help them
Okay.
to breathe again. Does that answer your question?
Were you asking how many didn't respond?
Well, how many of the overdoses that were non-fatal can be directly attributed to administered Narcan?
I see. Yeah.
I would say what you said. All of the
All
administrations
the
of Narcan were
non-responders.
So pretty much 100% then?
Yeah, I would.
Okay.
Oh,
You can, though, be administered Narcan and then it can wear off and then you can overdose again. So
Yes.
that could be an instance in which that could result in a death or depending on the trajectory of.
I don't know if
Yeah.
any of the overdoses were revived through other means.
Oh, I would think no.
I think no as well.
I was surprised by the number of people under 20. I thought it would have been higher than just 3%. When I heard on the internet and on radio, it seems that there's an increased number of people being involved early in pre-teens area and concern with Sarah. And when I look at the statistics, it's jaded more towards the mid-20s. Yet by the radio and that, I got the impression that there's really an epidemic going on in the grade school. In fact,
Well, and age of first use contributes to future use as well. So as that age of first use is creeping lower and lower, that poses risk for children to be users in the long run.
they tend to be a little more gullible too.
Or, hence Volition's tagline, know the facts, use your volition, really focusing on a fully informed decision. So know what you're getting into, know the facts of how your health can be affected, and then make your decision based on that.
But if they're not unconscious and they don't get the Narcan,
What was your question?
so that, I know a young person that overdosed and went to the hospital and they didn't go unconscious. But I don't think it was an opioid. So they would have been revived by a different means, so I just wonder, if someone overdoses and they don't go unconscious, let's say a parent knows their kid is and they take them to the hospital, then do they get the Narcan? Is that what it's called?
Narcan.
A
Narcan.
great person to
Is it
answer
just
that
for
would be our paramedic partners,
Yeah.
but do you happen to know that? I'm not familiar with the protocol of when they present to the ER, but we could definitely follow up with the paramedics.
I would think more than likely they would be getting their stomach pumped.
Yeah,
Charcoal, they use
it
charcoal.
really just, it depends.
Yeah.
There's multiple different things that we'd have to be concerned it would be. So,
Yeah.
'cause sometimes you don't want to use charcoal. Sometimes you don't want to, yeah.
Yeah. This is great. It's really impressive. I do have to say that overall behavioral health moved to Muskego. They're not here anymore.
Oh, they're not. Oh, okay.
I've heard people say part of your first aid kit, you should keep one of these Narcan in your possession in the house, just in case, because you really don't know.
Yeah.
You don't
Or
know.
even in your car.
Right.
I had a question. I think they're selling that over the counter, but it's like $45, $50.
It is, yes.
For the person that's using, or the parent that can't afford that, what are their options?
Good question.
Yes, so, yes, they did approve for over-the-counter. My understanding in reading some recent articles was that that is just starting to be officially become available over-the-counter, but it is expensive. So we are hoping, to hold some trainings with partners to be able to train, which they would bring Narcan with, and then when you're trained, they can give you Narcan. There is, state programs, Narcan Direct, that health departments and such can opt into to get Narcan for free to be able to give out to the community. That program is currently closed, so we're not able to apply to be in it, but there are several surrounding health departments and community organizations that are currently in that have Narcan that they can give out for free to people in the community, which has been very
Talk
helpful.
a little bit about harm reduction vending machines.
Yeah. So there is a page in here actually that talks about harm reduction vending machines, and we listed all of the vending machines in the county. It's on page 14.
So Green Hills Health Department.
Yeah, so we, in the Milwaukee County, at the state level, there were a bunch of grants coming out for harm reduction vending machines, and what those are literal vending machines that have Narcan, some have gun locks, they have fentanyl test strips in them. They're a completely free service and put somewhere in the community that anyone experiencing, substance misuse or family members can go, punch in the number just like a regular vending machine, and then out pops fentanyl test strips or Narcan, and that is free to them as well. We did recently learn that there is a new one that was placed in Franklin. It's at the Community Reintegration Center on 68th Street. So we are working to set up a meeting with them to kind of learn more about our new Franklin community vending machine. But there's additional ones throughout the county as well that health departments, that community organizations were able to apply for and get put into the community.
The Community Reintegration Center, is that connected to the correctional facility?
It was formerly known as the House of Corrections.
Oh,
So it's in their lobby.
okay.
But I think that this brings up a good opportunity that if this is something of interest of the boards that they would like Volition Franklin to look at pursuing, we could bring it forward for a letter of support at some point.
For a vending machine? Oh, okay.
Is this available to all citizens of Franklin?
Well, that is why we are here today. So I'm also going to have Megan talk about some exciting stuff coming down the Volition Franklin pipeline, which will take just a few minutes. But with that, we were hoping to present the information Megan will be sharing with you, that kind of end of fiscal year wrap up for Volition, as well as this report. This is draft version only based on font and spacing and things. But if you guys would recommend this forward to council, we would like to have your okay to go forward with this, to bring it forward in October. But go ahead and share your updates,
Yes.
and then we can
Okay.
make a motion.
Yes, so there is a Wisconsin Substance Use Prevention Conference coming up in the Dells this week, actually. And applications went out that people could apply for a couple of different things. So
People could be nominated.
could be nominated, thank you. Volition nominated a youth that currently is on the youth leadership team. She's outstanding. She does a lot of work in tobacco prevention. She's on the State Youth Tobacco Prevention Board. She also serves as a leader for Volition Youth at the high school level, kind of helps to organize that group. She has led meetings. She's kind of garnered a lot of support, gotten a lot of her friends into the group as well. So for all of the advocacy work she does, we nominated her, and she won. So that was super exciting. She will get a certificate from the state saying that she is an outstanding leader.
Her name is Zyra. She goes to Franklin Public School.
And then we also were nominated for Outstanding Substance Misuse Prevention Coalition. This is the first year they've done this conference, and we also won that nomination. So pretty cool for the first year to be nominated for Best Outstanding Coalition, Protecting the Pond. So I will not be there this week. My sister's getting married, so I won't be there, but Lauren and Ellen are going to go and accept the award on Volition's behalf. Very exciting.
And also one other thing you must mention
Yes.
about Blue Ribbon.
And so additionally, there
This is a month of fun.
It
we
is,
have to
yes.
say. All
Many
these
good things
things
are happening.
came in 1 week. But
Yes. So at the national level, we applied for a different award, I guess, to be a Blue Ribbon Coalition. And that is a coalition of excellence that help me out with this, I guess.
Yeah, through CADCA, which is the Community Anti-Drug Coalitions of America. They host a national leadership forum every year, and individuals who receive a DFC grant go through an extensive coalition academy. So you send 2 of your staff to this 3-week-long coursework, and Megan completed it, Ellen completed some, Ellen completed it, I did some, and you have these products at the end of it. So you need to show how you can sustain efforts, you're making actual change, you have data measures that show significant involvement of both coalition members, schools, partners. So Volition Franklin has some really innovative projects going on, and they submitted all of their products with the guidance of Megan and Ellen to CADCA and this National Leadership Forum, and out of all of the nation's coalitions that submitted, we're selected as a Blue Ribbon Coalition.
Wow,
So
congratulations.
yes, it's very amazing for them. So from that, they can go on to apply to Coalition of the Year for the nation. But it is also a tremendous honor that they were selected as a Blue Ribbon Coalition.
Yes.
So Megan and Ellen and the rest of Volition Franklin have just been having this wonderful month of well-deserved accolades. And so we're hoping to wrap that all up in a nice present for the Common Council and bring that with the toolkit. With Zyra and then Volition Franklin supporters in October.
So what type of motion would you be asking for?
I think recommend this report forward would be the most appropriate, and then we could bring forward a presentation to the council and they could place this on file. I was hoping Mike could kind of lead us there, but if you think that would be appropriate.
I will ask for the motion. I just want to make sure, is this draft complete? Are you anticipating any other changes?
Only other changes would be font size and
Okay.
just kind of cleaning up
So
the
as
charts,
is,
making
it's
sure
pretty
they're
much what you're
legible.
gonna present.
Yes.
But you're
Okay,
gonna add the vending thing?
I think it's in there.
Vending machine is on page 14, so that includes all of the vending machine locations in
but not
Milwaukee
for
County.
the health department, or not for
Correct.
the city hall?
Correct.
Okay.
But I suppose if Aurora's location did close, that would be one change we would make.
Yes.
We'll have to double check kind of the whole status of that, but then changing that Aurora services are offered here.
Yeah, I looked today, but I will give them a call to double check because if they've moved, I would omit that from the report.
Yeah, I talked about a month ago.
All right.
So I'm looking
Thank
for a motion to have the health department, and Volition Franklin, present the opiate misuse and overdose prevention toolkit for the city of Franklin to the Common Council.
So be it.
Second.
Second.
Any discussion? Hearing none, all in favor?
Aye.
Okay, it's been unanimously approved by the Board of Health.
Congratulations. Okay, our last bookend here is environmental health updates. So happy to provide that to everyone. You'll see in the report from the summer the number of inspections that we have done. Our environmental health staff have been very busy and still every day more work to do. It is really the thing to do in the summer to have food trucks and transient retails pop up. So we just got done with St. Martin's Fair, which was a huge event for our environmental health staff. We have an event at The Rock on Saturday, which we anticipate having about 20-ish vendors that we'll need to inspect and ensure that they're in compliance. Though we still have Jamie working a 0.4 FTE, as you guys remember. She increased from 0.1 to 0.4 with grant dollars this year. But yeah, busy as always and doing a lot of routine inspections. So 62 in the months of June, July, and August total, but many, many more to come.
Have there been any violations that we should be aware of?
There are always violations. But let me just think about this really quick.
Any restaurants shut down, any hotel concerns?
Nothing major on that front. I would say a point of conversation will be St. Martin's Fair. It brings in a lot of people that are from different municipalities, which is not unusual for a large-scale event. But for some reason, this is one of the most difficult years we've ever had with people being in compliance with the food code. So that was just an unanticipated challenge. So our staff were usually there about 3 to 4 hours, and they were there for 8 hours. But that being said, we're also going to be just having some conversations with internal city staff to kind of troubleshoot how we can make that an easier process, that things are crystal clear, and then a debrief with the St. Martin's Commission. That was a bummer. That was really, hopefully that improves. But no, typical things, a lot of it can be corrected on site, but that is our main focus right now, is just seeing how the remainder of these large scale events go, because that's when it gets tricky, because the event opens within the hour you're there and you're needing to have these corrective actions with the establishment as it's kind of all unfolding. And you want to keep the public safe, make sure food practices are up to par. And
Well,
sometimes that can lead to contentious
Will
conversations.
things change next year with convention?
That is a good question. So we had a nice trial run for the Almost DNC that came here. For that event, they had asked environmental health staff from other municipalities to volunteer their time to the convention, which we never got to that point because it obviously did not happen. But in places within our municipality may very well host events. So we're going to, it will depend on the scale of the event and who the attendees are. So sometimes they have independent people come in and be involved in that, or we may be just having an increase of events. But I think that we should anticipate an increase of events and need for routine and mobile establishment inspections with the trend of things. Food trucks are only getting more popular. So we'll need to look at the 2025 budget of what we're going to do for environmental health staffing here, because it is a big need here in the city.
And you'll keep us informed as we get closer and closer.
Yes, to the RNC. I'm glad you brought it up. Yes, definitely. Because we'll have a lot with our preparedness staff as well. We're already running plans and trainings and talking to fire and police regularly. So it is definitely on top of mind.
Okay. Okay, is there anything else anybody would like to bring up?
Oh, Megan, yes. Megan just has one other thing about Volition Franklin that they're hosting.
Yes, so Volition and the Health Department are partnering with a couple other health departments and the Conservancy in Franklin to host a question, persuade, refer training, QPR training, and it helps people ask questions for someone involving the possibility of suicide. So what questions to ask, who do you refer them to, and I believe it's for adults. There is another youth QPR as well, but I believe it is for how to speak with adults. So if anyone's interested, there's a QR code that you can register, and that will be, I believe it's Thursday, September 28th from 6 to 7:30 p.m. at the Conservancy.
Thank you. All right, thank you for remembering that last thing to sneak in. And then our next meeting will be in November.
Do you remember the date of that?
Second Monday, so let me pull that up. It will be the 13th.
13th. Okay.
Unless, of course, something comes up and we call the order in October.
Great. Are there any other questions? If not, I need a motion to adjourn.
I'll make a motion to adjourn.
Okay. Any discussion? Hearing none, all in favor of adjournment, say aye.
Aye.
Thank you very much, Juan.